How do Gepants differ from CGRP monoclonal antibodies? Imagine having two different tools to fight migraines, both targeting the same pathway but working in very different ways. That's what we're exploring today. If you've ever wondered how these medications compare, you're in the right place. Gepants and CGRP monoclonal antibodies both target the calcitonin gene-related peptide pathway, which is involved in migraine development. But they don't work exactly the same way. Gepants block the receptor for the calcitonin gene-related peptide, stopping it from attaching and sending pain signals. Think of it like putting a cap on the receptor so the peptide can't latch on. CGRP monoclonal antibodies, on the other hand, directly bind to the calcitonin gene-related peptide itself, preventing it from activating the receptor. So, one blocks the receptor, the other targets the peptide directly. This difference impacts how quickly they work and how long their effects last. When it comes to taking these medications, the differences are clear. Gepants come as pills or dissolvable tablets you take when a migraine hits or daily to prevent attacks. They are easy to use and act fast. CGRP monoclonal antibodies are given as injections or infusions. You get them once a month through a shot under your skin or every 3 months through enrollment for at a medical facility. If you prefer taking pills and want quick relief, Gepants are a good choice. If you don't mind injections and want less frequent dosing, the monoclonal antibodies might suit you better. Speed is another key difference. Gepants start working relatively quickly because they are taken orally and directly block the receptor. They're designed for acute relief, so you can take them at the start of a migraine. CGRP monoclonal antibodies take longer to reach their full effect, often several weeks or months, because they are used mainly for prevention. Their effects last longer after you stop taking them because they stay in your system for months. Side effects and how well they tolerate these medications also differ. CGRP monoclonal antibodies are generally well tolerated with few side effects, but some real-world studies show a slightly higher rate of adverse effects than clinical trials suggested. Gepants also show high effectiveness, but because they are processed through the liver, there is a greater chance of drug interactions and side effects. Interestingly, combining these two types of medications appears safe, with very few patients experiencing adverse effects when used together. Drug interactions are another point. CGRP monoclonal antibodies have very few interactions with other medications. Gepants, because they are metabolized in the liver, can interact with other drugs you might be taking. This is important for your doctor to consider when planning your treatment. Gepants are approved for both acute treatment and prevention. Some, like Gepant, can be used flexibly for either purpose. CGRP monoclonal antibodies are mainly approved for preventing migraines, not stopping an active attack. They are designed to reduce how often migraines happen. There's limited data about safety during pregnancy or breastfeeding. Doctors usually recommend stopping CGRP monoclonal antibodies 5 to 6 months before pregnancy and stopping Gepants 5 to 7 days before. We don't have enough information about use in children or older adults, but research is ongoing. Choosing between these options depends on your preferences and your migraine pattern. If you want fast relief with pills, Gepants are a good fit. If you prefer less frequent injections and focus on prevention, monoclonal antibodies might be better. Your healthcare provider will help decide what's best based on your needs.